who is Shauna Anderson from Hushabye Nursery, and she'll be talking about understanding ACEs.
Good morning. My name is Shauna Anderson. I'm here from Hushabye Nursery in Phoenix, Arizona. We are a withdrawal facility for infants experiencing neonatal abstinence syndrome, and we provide wraparound care for infants. Today, we'll be talking about understanding adverse childhood experiences and how to build resiliency to mitigate the negative effects of those experiences. So the first thing we want to look at is, what is trauma? So trauma is an experience that threatens life or causes physical injury. It's so powerful, it's so dangerous that it overwhelms an individual's capacity to cope with other points of trauma in their lives. An important thing to notice here is that trauma is not just the event that happens in the moment. When we think of trauma, we are thinking of three different E's. The first one is the event itself. This is followed by the way an individual experiences that event, which leads to long-lasting effects. So that leads us to adverse childhood experiences. The original study was done in the 90s with 17,337 participants who were primarily middle-class, college educated. There were two different areas that it was looking at. One was abuse, one was household challenges. That abuse could be physical, emotional, sexual, and it could be neglect. As far as household challenges, this is the person you live with may have substance use disorder, faced incarceration, mental illness, domestic violence, or having one or no parents. You can think of that as children being removed from their parents also would be included there. So what that experience found was that as the number of ACEs increased, the negative effects throughout an individual's lifetime increased. This is in both behavioral and health outcomes. So you can see here, looking at heart disease, 0 ACEs, 1 in 14, 3 ACEs, 1 in 7, with 7 ACEs, we're looking at 1 in 6 having a higher likelihood of heart disease. We also know that ACEs occur in clusters. So the chance of having someone just having 1 ACE is not very high. Usually there are multiple ACEs happening at the same time for a family. So that's kind of the bad news. The bad news is that there are long-lasting negative effects of adverse childhood experiences. We also know that those long-lasting effects can be generational, but they don't have to last a lifetime. There are specific strategies that can be used that mitigate those negative effects. One of those is safe, predictable relationships. This is almost the #1 way to mitigate negative effects of ACEs. The caring, loving support of an adult can change the life sentence of an ACEs score. So really fostering those relationships is key to mitigating negative effects. Also understanding systemic inequalities with those with lived experiences of trauma. We know that poverty, racism, all of those things can affect adverse childhood experiences. And finally, keeping a focus on what is strong in families, not trying to fix what is wrong with families, but looking at what are the things that families are doing well now and continuing to build what we call protective factors that protect families from the negative effects of ACEs. So how does that relate to the work that we are doing at Hushabye Nursery? So Hushabye Nursery works with neonatal abstinence syndrome, also called NOWS syndrome. As most of you all probably know, this is the condition that an infant experiences when their mother was using drugs such as opioids during their pregnancy. We know that infants who are born with NAS or NOWS at birth have 2 to 3 ACEs. What are those? Well, number one, they have a parent with substance use disorder. We also know that with substance use disorder often comes mental illness, depression, anxiety, post-traumatic stress disorder. And as we stated earlier, those ACEs occur in clusters. So the chances of having a family member that has experienced domestic violence or an incarcerated parent is also very, very high. So the question then becomes, how do we mitigate those risks in a concrete way? The programming at Hushabye focuses on building protective factors. These are the ways that we promote healthy child development and healthy relationship between parents and children. You can see that there are 6 of them listed. Many of them overlap. For example, nurturing and attachment aligns with understanding children's social and emotional competence. However, I'm going to really focus on 3 that our program seeks to provide for each family. But as I stated, there is a lot of overlap between all of the protective factors. So when we look at our programming, the Hushabye model focuses on 3 different areas: prenatal services. So we want families engaged in our services as soon as they find out that they are pregnant, so we can start giving them access to care and support. Our nursery, where families room in with their infants. Our hope is to get babies in our nursery at 24 hours before they start having acute withdrawal symptoms, where the families can room in with their infants. And then finally, our discharge services, which includes making sure that families have access to things like developmental services, and then our services are provided for as long as they want them. Our goal, again, is to build these protective factors in our families prenatally while they're in the nursery and after they are discharged. So let's look at the way that we really focus on doing this. Number 1 is parental resilience. This is that parent's ability to bounce back even in really stressful times. They can manage their stress and function well. At Hushabye, we offer this parental resilience programming through our counseling services. We have both family and trauma counseling, case management so that families have access to support. We provide our own support groups for both healthy coping skills, connecting with families, as well as recovery groups focusing on healthy coping skills. We also provide peer mentors and DCS support. This again is throughout all 3, inpatient, outpatient, and prenatally. Second, we really put a major focus on helping parents to understand parenting skills and child development, really looking at making sure parents have the skills needed to have positive interactions with their families that support the physical, cognitive, language, social, and emotional development of those families. This includes evidence-based parenting classes where we focus on specific parenting skills and child development. And we provide ongoing education and support both in the nursery, at discharge, and then making sure that families have referrals so that if there are developmental follow-ups that are needed, they have access to that. Nurturing and attachment is really, really important and a giant part of what we do at Hushabye. We provide breastfeeding support. As I mentioned, making sure that when families are rooming in, that they have the time to bond with their babies. We know that when families are in the NICU, they're often not able to be with their babies 24 hours a day, 7 days a week. They're able to do that at Hushabye. We have classes that teach how to build healthy attachment and bonding. And as I stated earlier, we know that one of the number 1 ways that we can mitigate the negative effects of ACEs is to build a strong relationship between one loving caregiver and a child. This is changing the outcome of this child, but we know that trauma and adverse childhood experiences are generational. So it is not just this child, but we are changing these negative outcomes for generations to come by providing this support. So what does this look like? When we are looking at our numbers from November of 2020 to December of 2021, we have a decreased use of morphine in the nursery, 98% in the NICU. Our rate is 25%. The length of stay of the infants is reduced when they are engaged in our services. And then what we're really, really proud of in terms of reducing that negative effects of ACEs is that when families are engaged in our services prenatally, they are at 77% chance, 77% of our families maintain custody of their infants when they go home. This approach reduces the negative effects of ACEs by keeping families together and keeping families healthy. We know this quote is so true. The more healthy relationships a child has, the more likely he will be to recover from trauma and thrive. Relationships are the agents of change, and the most powerful therapy is human love. And these are a few of our Hushabye babies. To reduce the negative effects of ACEs, the number one thing that we can do is support healthy relationships between parents and their children and provide the resources they need to be successful. That is how children will thrive. Thank you so much for your time today, and have a wonderful rest of your day.
Thank you so much, Shauna. What a wonderful program. We have time for a few questions if you want to type them into the chat. And while we're waiting, I actually have a question for you, Shauna. I am curious if the program incorporates any sort of nutritional interventions for mom, because there are quite a few nutrients that can play such an important role in stress and anxiety and depression. I'm just curious how that might fit in.
So we make sure that every family has WIC services. If they need SNAP benefits, we help to get them enrolled in those. And then it's actually something that we have been focusing on lately is how can we support families with healthy nutrition. And so we do some education on healthy nutrients. We have a whole program that I teach on what nutrients you need when you are pregnant, and the why. I think a lot of that is really important, helping parents understand why they need folic acid. Why do you need, vitamin D? So it's definitely something that we want parents to understand, and we work with our case manager to make sure they have access to healthy food.
That's really
the question, how do we incorporate babies in foster placement? That's a great question. So upon discharge, if we know a family is going into foster placement, those foster families actually come to the nursery and they do the same discharge education that our parents do. So making sure that they understand some of the specific strategies needed to soothe an infant with NAS, because it can be very different than other babies. Making sure that they, have support that they need. Also, all of our support groups and programming right now is done on Zoom. And so we open that up to foster parents as well, so that they can get continuing education and support.
Thank you so much, Shauna.
Thank
That
you.
was a really great presentation.
Thank you. See some names I see on the chat box. So thanks everybody. Some names that I know. Have a wonderful day.